So I'm Gaetan Duport. I'm physiotherapist in private practice in Lyon, in France. Those are my disclosures. I have nothing to declare. 6 years ago, just after my graduation, a medical doctor asked me, aren't you ashamed to enter in a physiotherapy program when you know you are an hemophiliac patient? Those words didn't affect my determination, and I will explain you why patients and caregivers are added value for the community in bleeding disorders. So, what are the specific skills for physiotherapists in hemophilia? Physiotherapists are involved as experts on bleeding disorder clinic. There are treaters, and to be treaters, they must be trained by a senior physiotherapist in a hemophilia treatment center or by a WFH program. Assessment in hemophilia is the daily practice for all physiotherapists in HTC. Scoring and imaging become the daily routine in hemophilia treatment center. But physiotherapists are also coaches. They spend a long time during 1 or 2 appointments a week with patients, and we create a strong relationship and a unique relationship with their patients. Education is the common goal for pros and patients organizations. Physiotherapists has a key role in function independence and the well-being. It leads to what we call empowerment. Physiotherapists are also part of comprehensive care centers. Many HTC and CCCs in the world doesn't engage physiotherapists. For my example, I live in Lyon. It's the National Comprehensive Care Center for Hemophiliac patients, and I'm not engaged in the HTC. According to this slide, what will be my added value and what will be the added value of patients with hemophilia. So as you can see, we talk about PWH, people with hemophilia, and I've just graduated with a T, so I'm a PTWH, a physiotherapist with hemophilia. So do I care for a patient differently? I don't know, but I think my academic knowledge is common with my colleagues, and I have to work harder to be recognized as a physiotherapist and not as a patient by other healthcare people. Do I coach in another way? Well, I can't answer to this question. I think you have to ask colleagues or patients. But I think I'm a confidant for lots of them. I'm not a friend, and it's very hard to take and to put a barrier. But when I have patients with bleeding disorders in my practice, I try to make the difference. What about education? Well, daily experience is an advantage because I can identify what will be interesting for people with bleeding disorders or not. And I've also on other work because I'm a volunteer for the French Hemophilia Society and I'm the chairman of the education group. Am I more involved as a team member? Well, as I said just before, I think patient organization and hemophilia treatment center have the same goal. They try to implement and they try to go to a better quality of life for all people. So we will see a lot of changements in the next decade because we will have novel therapies and maybe gene therapies in the decade facing to us. So number of bleeds for patients will continue to decrease in Western countries. But we will still face several adults with severe hemophilia without hemarthrosis. And we have to be aware that managing fears and kinesiophobia will still be important and a problem for us physiotherapists, because we don't have lots of key to help them about fear avoidance or fear of movement. You know, I see teenagers without hemarthrosis, and they have the same problem as I had and as my generation had 15 years ago in the relation with other people and in the strategies to go forward. The follow-up in the future will be reinforced in the coach area and education skills, especially for patients who were without treatment and will be treated. I think at patients with von Willebrand disease or at patients with inhibitors. So PT's role will continue to be important, even if hands-on interaction will decrease. What about my place as a physio and as a patient? I'm still a patient with a 30 years experience. Thanks, Mum. I need to manage my own life with my bleeds and with my injuries, and I can't work as a full-time physiotherapist, but I have to deal with maybe 10 or 15 days without working in a year. For many patients, I'm considering as a peer, and for some of them, I'm a sort of hero or an example. And I'm not very kind with it. And I try to stay in the role of a patient with the French Hemophilia Society and in the role of healthcare pro in my practice. For some professionals, I'm no longer a patient, and I heard so many times this sentence: we can say to you something we can't say to other patients. So it's also very hard for me to hear that, because I remain a patient for my life. And I can't live just with patients with hemophilia or with von Willebrand disease in my practice, so I help other people with diseases as cerebral palsy and as type 1 diabetes. And the relation I have with those patients is different, and I'm very interested in those fields, but in bleeding disorders, I'm very, very interested and motivated. So this creates a two-hat phenomenon, and it's the deal with my condition. So, am I a patient or am I a physiotherapist? On one hand, I have my 30 years experience with hemophilia as patient, and on the other hand, I have a 6 years practice as a junior physiotherapist with bleeding disorders patients or with other diseases. If you compare this experience, if you compare this with that of an average seasoned MD or seasoned professional, you may be thinking that I have more experience than a seasoned doctor or other professional. But what is key is that patient experience is not professional expertise. So look at this picture. What is the link between those two pictures? There is not a full crowd, so you can speak. What is the link for you? It's not about the team, it's the same team, the Real Madrid. Yeah, for sure, it's Zidane. So why I put Zidane? It's not about his haircuts, it's more about the player he was. He was one of the best players in the world, and now he tried to become one of the best coach in the world. And he did that just because he has the ability to create strong relationship. Your knowledge, graduate or condition doesn't matter if you don't know how to build strong relationship. I'm sorry, but if there is Scots in the room, I could use Sir Alex Ferguson, but I didn't know very well what he did when he was a football player, so I put Zidane. It's not because I'm French, and I'm not a very fan of football, to be honest. So what have we done in France? We built a group with the French Hemophilia Society, with professionals, with patients, with families, and we try to modify the model of relationship. Patients and families are more confident with peers, and patients and caregivers have a strong and long experience to build a better education system. And I think we have to advance. In 2012, Vince and Al showed that involving peers in medical relationship increase the adherence of treatments and also reinforce conviction. So you all know what is a paternalist model because it's the beginning of the medical relation. Paternalist model is a model without interaction, where everything is vertical and you don't have an exchange with your doctor or with your professional. Co-decision is a model built on a common ground between patient and his family and healthcare professional to go to a common goal. And in the future, we will enter to the shared decision-making area. I can speak a lot about shared decision-making area, but it's not the topic today. Just to introduce you, the shared decision-making area or model, it's the co-decision model with tools to help people and physicians to take the best option without the influence of each other. In France, in 2010, we created the Patient and Parent Resource Program. First, we built a benchmark to have competency standards. So those are the 5 competences necessary to acquire for people with bleeding disorders in education. You have to know how to care yourself, how to treat, how to take decisions, how to prevent and adapt, and how to inform. This is the guidelines. It's in French, and it's just written competencies and objectives for severe hemophilia. So what were the requirements to enter in this program? First, patients or parents must have the agreement by the Hemophilia Treatment Center or one of the 22 local French Hemophilia Society chapters. Parents must face prophylaxis for 3 years or more for their children. We just want to let time to parents to see where the path for them since the diagnosis and since the beginning of the prophylaxis. Training were done in 3 sessions, about 40 hours. The first and the second session was only for parents and patients, and the third session was available for pros. So it's very tough to understand that at the beginning of the program, but we said we will try to train people, patients, families, and also healthcare professionals in the same room for the same thing. So what is the role of a patient or a parent's resource? It's a brainstormer, someone who can reformulate, someone who can use his own word objectively without his feeling to help people to acquire a better education. It doesn't replace the healthcare professional. It's not a team member of the hemophilia or treatment center, but it's an active, a doer in education. It's not an accompaniment, it's someone who can help people to acquire skills in education. For accompaniment at the French Hemophilia Society, there is over people, and that's another program. Today we have 42 parents and patients involved in this program. So on this photo, you can see there is nurses, physiotherapists, doctors, patients, and parents. And I can't say to you each of them because it's very hard to recognize them. And so that's the ultimate goal. Who is doctor and who is nurse and who is patient and parents, we don't know. I had also on the slide the different societies who built this program. There is the French Hemophilia Society, the National Center of von Willebrand disease, of also hemophilia, the Society of Physicians, Society of Nurses, Physiotherapist Society, and also the University Paris 13 and the Society of Pharmacists. So, what is my message? Healthcare pros are not keen of involving a patient as a pro. They like me, we talk a lot, but they are not breaking down my door to hire me. In education, nothing concerning patients can be done without the patient and the professional agreement. To be a patient or a caregiver is the strength, and you have to use it for the community. And if you are an healthcare provider or an healthcare professional, you have to help people in empowerment, so this program can be help you. So it's the key message, working together. I don't know if I'm a patient, I don't know if I'm an healthcare professional, but I try to work with everybody. Thanks.